We're here today to announce that Baltimore Healthy Start, in partnership with the Health Department and others, has been named one of Merck's 9 awardees for the Safer Childbirth City Initiative. I want to congratulate Healthy Start for this very important award for Merck, which will allow us to conduct severe maternal morbidity reviews and understand how best to improve postpartum care for mothers in the city. This award is also tied to a win we had in 2019 legislative session to allow local jurisdiction to conduct a local Maryland mortality review. Previous maternal mortality was only reviewed by the state, their stakeholders, but now Baltimore City will review local maternal deaths and will use findings to recommend changes in healthcare and public health practices to prevent future mortality. The review process will begin in 2020, and we will be putting out a request for applicants for team membership this fall. The review will allow us to understand the specific issue driving maternal death in Baltimore City and implement targeted intervention strategies. It will uncover and tackle problems in the local health and social service system in partnership with local service providers sitting at the review table, where they can take immediate prevention actions. They will engage local providers and residents to address the social, economic, and health factors related to maternal mortality. For example, the leading cause of maternal mortality in Maryland is unintentional drug overdose. And while a medical review of the case is critical to prevention, so is a review that seeks to understand the wide range of factors contributing to these deaths. Congratulations again to Baltimore Healthy Start, and thank you to Merck for selecting Baltimore City. Thank you, and now we will have Lachelle Stewart, Executive Director of Healthy Start, to say a few words about the programming involved with this new grant.
Good morning, everyone. Baltimore Healthy Start is honored to be selected as a grantee by Merck for Mothers as part of the Safer Childbirth Cities Initiative. The overarching goal of our project is to establish mechanisms and practices to improve the responsiveness, quality, and timely utilization of clinical care in order to reduce the incidence of severe maternal morbidity, maternal mortality, and associated racial disparities in Baltimore City. We will partner with the Baltimore City Health Department, Be More for Healthy Babies, Total Health Care, MedChi, the Maryland Hospital Association, the Pre-Eclampsia Foundation, and several local delivery hospitals to enhance the state of Maryland's maternal mortality review process with severe maternal morbidity reviews, to provide postpartum care services co-located and co-scheduled with pediatric visits, to implement a maternal health monitoring intervention program to enhance our home visiting services, and implement a Patients as Partners initiative to elevate patient experiences and improve quality care. Our Deputy Director and Chief of Quality Assurance and Clinical Affairs, Maxine Reed Vance, will serve as the project manager, and Peter Schaefer has been named the Senior Prospect Collaboration Manager for the project.
Okay, I think Jacqueline is next. Okay.
Good morning. Through Merck for Mothers, Merck aims to help create a world where no woman has to die giving life. It reflects our commitment as a company to save and improve lives, to take on the toughest health challenges, and to use our scientific and business expertise to catalyze sustainable solutions that deliver value for society today and for future generations. We launched the Safer Childbirth Cities Initiative because a woman in 1990 had a better chance of surviving childbirth than her own daughter does today. And because Black women specifically have 3 to 4 times the risk of white women. This should not be, and we can all do better. We are delighted to support this new effort and our deepened commitment here in Baltimore to change this narrative and reverse the worrying trends. Cities like Baltimore have the power to bring about major change for improving health for women in this city and across the country. We commend Baltimore Healthy Start and its coalition of partners for the bold and innovative approaches that they will take to improve maternal health and to make Baltimore a safer and more equitable place to give birth for all women. Congratulations.
Whose book is this? Okay, I think Michelle is coming to speak now, or is it Francine Childs? Francine? Because I got mixed up here.
Good morning, everyone. On behalf of Dr. Letitia Duraza, Baltimore City's Health Commissioner, I would like to congratulate Baltimore Healthy Start on the significant award from Merck's Safer Childbirth Cities initiative. These funds will be used to identify ways to better serve postpartum women in Baltimore City. For many years, Baltimore City Healthy Start has served as the hub organization for the provision of perinatal services in Baltimore City. Baltimore Healthy Start has directly provided comprehensive home visiting, care coordination, health education, and reproductive life planning services utilizing formal and informal models of life course perspectives to more than 20,000 pregnant and postpartum women and their infants and toddlers in some of the most distressed communities in Baltimore City. Additionally, this organization has, for several years, demonstrated success in improving pregnancy outcomes among its enrolled clients, particularly in reducing infant deaths to near zero and eliminating the threefold disparity in very low birth weight births between African Americans and whites. We believe that Baltimore Healthy Start's new severe maternal morbidity review and Baltimore City's new maternal mortality review processes will both serve as key catalysts for driving down the maternal morbidity and mortality rates in the city. The Baltimore City Health Department has had a continuous presence on the Baltimore Healthy Start Board since its inception and looks forward to continuing and strengthening its partnership with Baltimore Healthy Start. Again, congratulations on this achievement.
Thank you.
Is that all of the speakers? First of all, I want to congratulate Healthy Start again. As a former board member of Healthy Start, I know the great work that Healthy Start has done long before there was anybody else. Healthy Start was the program that really took care of young women who were pregnant. So I just want to congratulate them on the job well done, because they've been around for over a decade doing the great work of really serving the residents of Baltimore City. And I just want to commend them and thank them again. Is there any questions surrounding this?
How much is the grant for, and then how will it?
I think it's
How will it improve
about $1 million,
lives?
right? It's about $1 million.
It's 989,000
Over how long?
over 3 years.
How are you going to use that money?
I'll let the project manager speak to that.
We're going to establish a severe maternal morbidity review process in the city. We're going to co-locate pediatric visits with postpartum visits, and we're going to teach moms how to tell their stories.
Well, talk about that, tell their story business.
Yeah, it's very powerful when a woman tells her experience. When we give birth, we like to tell our labor and delivery experiences. It's a subject of conversation among women historically. But when we learn to tell our stories when things haven't gone as well as they should have gone, and it's very powerful when you listen to those stories and listen to a woman's heartbeat when she recounts what happened to her when she was giving life.
One of the things that was said there, the leading case in Maryland is unintentional drug overdose. Could someone fill me in on that?
The leading cause of maternal mortality really is a pregnancy-associated deaths. There is a distinct definition for maternal mortality, which is 42 days after delivery. There is pregnancy-related and pregnancy-associated deaths, which occur within 365 days of delivery. And we find that women after delivery, because perhaps they had a substance use disorder prior to pregnancy, they tend to wean themselves off of whatever the substance was, and after delivery, they may begin to use those drugs again. And when they do, they may go back to the same amount that they were using previously, and the body has adjusted to something different. And there's an accidental overdose, which results in death.
Any more questions? Thank you. Congratulations again, Healthy Start.
I just want to thank you for giving us the
Oh, yeah. Oh, yeah.
Thank you for always looking out.
That's right. I will continue to do that.
Got the right one?
A card by any chance?
Yes, I do. It's in my purse.
Okay.
Say it again.
Okay.
Y'all going to see me tomorrow, so you can hold those questions for tomorrow. I'm quite sure you can. Thank you.